Hello, I'm Dr. Chloe Bennett. Today, we're going to have a very important and very private conversation. The title of this video is not designed for shock value. It's a direct message, and it's one I believe is medically crucial. If you have stopped masturbating after 60, you truly need to watch this. This isn't a conversation about morality, loneliness, or shame. As a physician, I'm not interested in that. I am interested in your health. I am interested in function. And I am interested in a fundamental biological principle that governs our entire bodies. Use it or lose it. I had a patient, let's call him David, a 68-year-old man who came to me with his wife. They had a loving relationship, but their physical intimacy had faded. David told me, "Doc, it's not just that the desire isn't what it used to be. It's that my body doesn't seem to remember how to respond anymore. It feels like a part of me has gone dormant." David's experience is incredibly common. Many men and women, as they age, simply stop engaging in solo sexual activity. It might be due to a lower libido, physical changes, the loss of a partner, or simply a feeling that that part of life is over. But what if I told you that stopping isn't a passive act? What if I told you that, from a physiological standpoint, ceasing all sexual activity can actively contribute to the decline of your sexual function? Today, we are going to talk about why continuing or restarting a practice of sexual self-care isn't just okay. It can be one of the most proactive things you can do for your long-term vitality. Part 1. The use it or lose it principle. A frank look at your anatomy. You understand this principle for the rest of your body. If you stop using your muscles, they atrophy. If you stop challenging your brain, your memory can fade. Your sexual anatomy operates under the exact same rule. It is a complex system of tissues, blood vessels, and nerves that requires regular exercise to stay in working order. For men, the penis is not a simple muscle, but it is made of erectile tissues that thrive on blood flow. When you get an erection, these tissues fill with oxygen-rich blood. This process does two critical things. It nourishes the tissues, and it stretches them, keeping them flexible and elastic. When regular erections stop, the tissues can suffer from a lack of oxygen. This can lead to a condition called corporal fibrosis, where the elastic tissue is slowly replaced by less flexible collagen fibers. The result? The tissues lose their ability to stretch and hold as much blood, which can make future erections more difficult to achieve and less firm. Regular erections, whether with a partner or solo, are a form of physical therapy for this tissue. For women, the principle is remarkably similar. For a woman, arousal causes a rush of blood flow to the entire genital area. This blood flow is vital for keeping the vaginal tissues healthy, thick, and elastic, especially after menopause when estrogen levels decline. When sexual stimulation and arousal cease for long periods, the lack of blood flow can accelerate vaginal atrophy. The tissues can become thinner, drier, and less flexible, which can make any future sexual activity uncomfortable or even painful. Regular self-stimulation that leads to arousal helps to maintain this crucial blood flow, keeping the tissues healthier and more responsive. Part 2. The surprising health benefits. It's not just about sex. The benefits of maintaining sexual activity go far beyond just the sexual organs themselves. This is where the science gets truly fascinating. 1. Prostate health for men. This is a significant one. While no single activity can guarantee you won't get cancer, several large-scale, credible epidemiological studies have suggested a strong correlation between frequent ejaculation and a reduced risk of prostate cancer. One of the most famous of these, a long-term study, found that men who ejaculated more often had a notably lower incidence of the disease. The working theory is that regular ejaculation may help flush out the prostate gland, clearing out potentially harmful substances and preventing the buildup of old cells. This is a powerful argument for not letting this bodily function go dormant. 2. Pelvic floor strength. The muscular contractions that happen during orgasm are a workout for your pelvic floor muscles. For both men and women, a strong pelvic floor is crucial. In men, it contributes to erectile rigidity and ejaculatory control. In women, it supports bladder control and can enhance the intensity of orgasm. Allowing these muscles to fall into disuse is like stopping your core exercises. The entire system can weaken. 3. The brain and mood connection. When you orgasm, your brain releases a cascade of powerful neurochemicals. Endorphins. These are your body's natural painkillers and mood elevators. Oxytocin, Often called the love hormone, it promotes feelings of calm and relaxation. Dopamine, the reward chemical that is central to feelings of pleasure. This natural chemical cocktail is a potent stress reducer. Many of my patients report that regular orgasms lead to deeper, more restful sleep and a general improvement in their daily mood. It's one of nature's most effective anti-anxiety remedies. Part 3. Overcoming the barriers. How to start the engine again. I know what some of you are thinking. That all sounds great, Doc, but it's not that simple. And you are right. There are real barriers. Let's address them head on. Barrier number 1, my libido is gone. A lower sex drive is normal with age. The key is to stop waiting for spontaneous desire to strike like lightning. In long-term relationships, and as we age, desire often follows arousal, not the other way around. You don't have to feel like it to start. Begin with gentle, non-demanding touch. Explore your own body with curiosity, not with a goal. Sometimes, the physical act of touch itself is what awakens the desire. Barrier number 2. It's uncomfortable or painful. This is especially common for postmenopausal women. The solution is simple and essential. Use a high-quality lubricant. There is no shame in this. Think of it like using reading glasses. Your body has changed, and you are simply giving it the tool. It needs to function comfortably. For men, if erections are not as firm, gentle stimulation is key to avoid discomfort. Barrier number 3. I feel guilty or ashamed. This is a powerful barrier, often rooted in how we were raised. It's time to reframe this. I encourage my patients to stop thinking of it as masturbation and start thinking of it as sexual self-care or sexual wellness maintenance. It is a private, responsible health practice, no different than stretching to keep your muscles limber or doing puzzles to keep your mind sharp. It is about taking ownership of your body's health. Barrier number 4. I don't have a partner. This is precisely why solo sexuality is so important. Your body's need for the physiological benefits of arousal. An orgasm doesn't disappear when you're single. Sexual self-care is the primary way to ensure your sexual systems remain healthy, functional, and ready for a future relationship, should one come along. It keeps you connected to your own body. Conclusion: a prescription for vitality. So, if you've stopped masturbating after 60, what should you do? The first step is to change your mindset. See this not as something shameful or optional, but as a vital part of your personal health regimen. The secret is not a trick. It is the understanding that your sexual health is intertwined with your physical, mental, and emotional health. It is a system that benefits from regular, gentle exercise. By reintroducing sexual self-care into your life, you're 1. Protecting the physical tissues of your sexual anatomy. 2. Supporting your prostate health and pelvic floor strength. 3. Boosting your mood and improving your sleep through natural brain chemistry. 4. Maintaining the crucial mind-body connection that is central to all pleasure. I want to challenge you today, not to do anything drastic, but simply to consider this information. Think about your body as a system that deserves to be maintained with care. What is the biggest barrier you've faced in this area? Sharing your thoughts respectfully in the comments can create a powerful sense of community and show others they are not alone. If you found this honest medical conversation helpful, please give this video a like. It helps this important message reach those who need it. And please, subscribe for more science-backed guidance on aging with dignity and vitality. I'm Dr. Chloe Bennett. Thank you for your courage to have this conversation with me. Be well.